I call Rachel Gilmore to move the motion.
Thank you, Mr. Chairman. Need a pharmacy myself at the moment. I beg to move that this House has considered government support for community pharmacies in Devon and in the South West. I am delighted to have secured my first Westminster Hall debate, and it is an honour to speak under your chairmanship, Mr. Betts. At a time like this, where we repeatedly hear from government and from our own communities that the national health crisis is under strain, headed into yet another winter crisis and struggling with capacity, community pharmacies need the greatest consideration for further government support. With permission, I would like to start these remarks focusing on the roles of pharmacies in our society and then outline some of the real challenges before ending on what we might be able to do with the right level of support and engagement. In doing so, I wish to thank all pharmacists and their staff in Tiverton and Minehead for the invaluable work that they do day in and day out. In particular, I wish to commend Neil and Anna, who have run Bampton Pharmacy in my home village for decades and have, along with Wiveliscombe Pharmacy and Ulcombe Pharmacy, provided me with first-hand, real-life insights into the challenges they face. In my constituency of Tiverton and Minehead, the 15 pharmacies we have are of vital service to their communities, something which is shared by every pharmacy across Devon and Somerset, the South West, and indeed across the whole of the United Kingdom. As we will hear during this debate, I am sure from honourable members, those pharmacies are under threat from the economic environment in which they now operate. Core pharmacy funding has decreased in real terms by more than 30% since 2016, and costs have gone in exactly the opposite direction. The number of pharmacies open in England is now lower than it has been in any year since 2008-2009, even though the workload of those pharmacies is 40% higher than then in terms of annual prescriptions.
Would she give way?
Of course I will.
I thank my honourable friend for giving way, and I thank her for securing this really important debate. Community pharmacies, as she was laying out, face large funding gaps, which has led to pharmacies in Glastonbury and Somerton having to close, a rate of closure nearly double the national average. So in light of the forthcoming independent economic analysis commissioned by the NHS England, does my honourable friend agree with me that the government should commit to publishing the economic review in early 2025 when the work is concluded? And does she also agree with me that we must reform community pharmacy funding and put in place a sustainable long-term funding model?
I do indeed agree with both of those courses of action, and I thank her very much for her very important and interesting contribution. So as I was saying, this is not sustainable, the increase in terms of the workload, and the workload is too important to not receive proper backing from central government as they make headway on their ambition to create what they have referred to as a neighbourhood health service on occasion. I'd like to go through things quite logically, being a Devonian. So I'd like to talk about prescriptions first. Just in Tiverton and Minehead, each pharmacy on average dispenses 7,540 prescriptions every month. Across all 15 pharmacies, that's 113,175 prescriptions on average each month across the constituency. That's 20,000 more prescriptions each month than the House of Commons Library says there are people in the entire constituency of Tiverton and Minehead. Prescriptions which provide life-altering medications for constituents are the front door to the work of pharmacies. It is what most people think pharmacies do most often. But there is a lot more work that pharmacies do in our villages, towns and cities. Of course.
I thank my honourable friend for giving way. It matters not really if your community pharmacy is in Devon or within my constituency in Caerfyrddin. Drugs tariffs, which put such a strain on our pharmacists, need to be reviewed, and an uplift is long overdue. Would my honourable friend agree that we need to highlight this financial shortfall to the government and something needs to be done immediately about this?
As often as possible, I agree. I'd like to move on to the workload, and this is not a typical example I'm giving. Along with prescriptions in Tiverton and Minehead, each pharmacy conducted 398 flu vaccines on average, higher than the national average of 355 during the 23-24 season. If members here are unfortunate enough to need their blood pressure checked, then they can go to a pharmacy. Across the UK, 930,000 hypertension blood pressure checks are undertaken in just 1 year. With public health as a driving mission of this government, I would hope that this is something that the government could support wherever it takes place. Pharmacies also offer a range of other clinical and public health services, including providing flu and COVID-19 vaccinations, and if further services were to be commissioned from community pharmacies in the context of a sustainable core funding, the sector could do even more to improve access to primary care. Yep, go on. Mr. Shannon.
Thank you very much. Mr. Chair, can I first of all thank the Honourable Lady for bringing this forward. The Honourable Lady has touched upon the issue of funding, and quite clearly for us in Northern Ireland, we have already made that commitment because it's a devolved matter. Some £15 million additional money has been set aside for community pharmacy and GP pharmacy, and extra money is beyond April 2027. If we want to achieve what the Honourable Lady wants to achieve, I want to achieve that, we all want to achieve that, then Government and the Minister has to invest accordingly. Does she agree?
I do.
Rachel Gilmore.
In addition to delivering formally commissioned services, pharmacies provide an alternative point of contact for the public for informal clinical advice. The 2024 Pharmacy Advice Audit found the average pharmacy carries out around 22 informal consultations per day, equivalent to 1.3 million informal consultations taking place in community pharmacies every week. Yes.
I want to congratulate you on securing this debate, and I know that from the very first day that we met, we talked about getting this debate in, so I'm really pleased that I spoke with the Honourable Member about getting this debate in, so I'm very pleased that it is happening. Does the Honourable Member agree with me that community pharmacy, and I am the chair of the community pharmacy APBG, community pharmacy has a huge amount of potential as she sets out to support patients with a range of services that will support the NHS long-term plan, the 10-year plan, to move more care into the community and also to help prevent ill health in the first place, and that's one of the main roles that they can play in the future.
I thank the Honourable Member for his contribution, and as the Honourable Chairman knows, I'm particularly keen on strategies, particularly the one that you've just made reference to. Pharmacies are not paid for these informal advice sessions. In over half of these occasions, if the patient had not been able to access their local community pharmacy, they would instead have visited their GP surgery. And this suggests that we've been able to free up 37.7 million GP appointments over the course of a year simply by patients having access to their local community pharmacy, which goes to the point that the Right Honourable Gentleman just made, or even the Honourable Gentleman. The workload is commendable, but it's just not sustainable in the current funding model. And that has meant that over the autumn, the MPA found that pharmacies are overwhelmingly willing to reduce services in order to protect patient safety and preserve access to pharmacies, if there is not to be funding provided to protect the network. They don't want to do this. They know the impact that reducing a pharmacy service can have on a community. But if the choice involves one of the options as continuing in an overstretched, under-supported environment, then for pharmacists and anyone committed to delivering health and health-related service to vulnerable people, it is simply not a real choice. Hang on a minute, who's first? My honourable friend from Bridgewater and Highbridge.
Thank you. Thank you to my the honourable lady and my neighbour for securing this debate and for giving way. Would she agree with me that the many benefits that community pharmacies provide are in danger? Because in many cases the pharmacist is not reimbursed even the cost of the prescription drugs. And would she ask with me that the Minister reply specifically to that very point?
Thank you. I will of course do that, and I happily give way to my honourable friend from Yeovil.
Dance.
Thank you very much, my honourable friend, for giving way, and I congratulate you on organising this vital debate. It's so important. In my constituency of Yeovil, pharmacies provide vital services, including over 6,700 prescriptions per month. Not quite as many as in your constituency, though, Rachel. Sorry.
Pause. The chair, please.
Yeah, thank you. Sorry. Since the launch of the Pharmacy First service this year, it's estimated that pharmacies in Yeovil have saved at least 556 GP appointments. However, lack of investment and the rise in national insurance contributions are threatening the amazing work done by pharmacies in Yeovil and across the country. I understand from a response I received to a parliamentary question...
To be brief and to the point for the honourable member to respond to, not another speech, please.
So, OK, would my honourable friend join me in urging the Minister to provide us a clear timeline for the consultation to start? Thank you.
Thank you. Thanks to the honourable member for Yeovil for being not particularly concise, but necessarily erudite in the question that he's asked me. I would like now to turn briefly to the funding models of pharmacies. 90% of pharmacies' income is derived directly from NHS funding, but when it comes to how that funding is allocated, the system is broken. Community pharmacies across the UK dispense over 1.1 billion items per year and deal with shortage issues on a daily basis. The Department for Health and Social Care set reimbursement prices in our system, but due to these reimbursement prices being so low and pharmacies being unable to compete on the international stage, it means that the global market is now a safer bet for pharmaceutical companies than the UK. This means that people in the UK sometimes aren't able to get the right medication due to shortages, but also that even when the DHSC put together a price concession and allow for a greater reimbursement rate to allow UK pharmacies to compete these life-aiding medications, there are extraordinary pressures on the NHS and the taxpayer. The realities of this funding model means that community pharmacies are trying to push water uphill, using tools riddled with holes. In other words, sieves. Briefly.
I thank my honourable friend for giving way. Would she agree that in addition to the issues over the cost of drugs, that also the funding model for providing all the other services that pharmacists are expected to provide this way, including the pharmacy first approach to avoiding GP appointments, that the funding for that also needs addressing?
I thank my honourable friend for that contribution. I will be coming to Pharmacy First at the end of this debate because I see that as the solution rather than the problem. So the sector is trying to do its hardest, but without a fundamental overhaul of this system, these NHS services, much needed by patients and the public, may fall by the wayside into one of the following pits. Hours lost. When the money isn't there, pharmacies can't operate. As we see in many areas across the South West and the UK, and in Tiverton and Minehead, we have seen hundreds of hours lost to temporary closures of pharmacies. According to the CCA, pharmacies across the South West have cut opening hours to the tune of 130,400 hours over just more than a year and a half, through reducing their opening hours, and according to CPE, from October 2021 to May 2024, in my constituency alone, over 520 hours of pharmacy time were lost due to temporary pharmacy closures. When pharmacies operate all of the services that I mentioned in the first part of this speech, and more, I just don't have time to go through them all. These closures take a toll. They take a toll on the GP and AE staff, who might be someone's next port of call if they can't see their pharmacist. They take a toll on the NHS 111 lines if the individual calls in, and they take a toll on the people who might not have any other free time in that day to take care of their health needs. These lost hours add up, and when pharmacies can't provide those appointments or other services, it leads to bottlenecks elsewhere in the system. Over the first 3 months of Pharmacy First, a service I will move on to shortly before the end of this debate, simply by offering consultations for the 7 applicable conditions, pharmacies took 234 appointments out of the GP system. Pharmacies have a fantastic potential to relieve that pressure and provide new ways to access medical services, receive advice, and so much more. Pharmacies can't fulfil their potential if they are closed, and the prospect of local pharmacies closing really does scare people. 83% of respondents in a recent poll reported that they would be concerned about their local pharmacy closing. Data shows that closures are disproportionately taking place in the most deprived areas, with 50% of the pharmacy closures recorded in areas in the lowest 3 deciles for deprivation. Again, according to... Briefly.
Thank you. Just further to the point raised by the Honourable Member for Exeter, isn't that the nub of the point? That if the government are going to make these 3 shifts, and importantly from hospital to community, they must have, and indeed not only stem the loss of pharmacies at present, but actually to build them up in order for the government to be able to deliver that shift to the community. So we need to build them up and to stem the loss.
I see it as a pyramid, that you have pharmacies at the bottom, and it goes like that right up to operations and A&E at the top. Again, according to the CCA, nearly 200,000 hours of pharmacy time was lost between September 2022 and June 2024 due to pharmacies closing their doors permanently. Over 1,000 pharmacies have closed since 2016, and a net loss of 136 pharmacies in the South West over the last decade, including in Tiverton and Minehead, where we didn't have very many to begin. The number of pharmacies operating now is the lowest number of pharmacies open overall in England since 2008-2009, and there are reports across the sector of sustained difficulties in staffing these pharmacies, even the ones which remain open. The sector cannot sustain these exits, and nor can our communities, where these community pharmacies are so very, very vital. Our pharmacies across the South West and Devon need proper investment in order to safeguard and fix our broken pharmacy system, and to make sure that our health system is up to scratch and that our social care system is supported. Thank you, Mr. Chairman.
Right, we'll move on to backbenchers now. Just for an indication of how many people want to speak. I've got 5, 6, 7. Okay, we're probably going to have to ask to keep to about less than 5 minutes if we can. Just to also say, we may have a vote at some point. We may have to suspend the sitting for 45 minutes because of the number of likely votes. So please do not speak unless you're prepared to come back when the debate resumes. All right, Sadiq Hassan.
Mr. Chair, it is a pleasure to serve under your chairship. Over the past 2 decades, I've had the privilege of working in a range of community pharmacies across the South West and elsewhere, and I want to thank the honourable member, the member for Tiverton and Minehead, for the best birthday present I could ask for, an opportunity to talk about a passion that has defined my life and that I'm still proud to practice today. I started my journey in community pharmacy studying at that pearl of South West education, the University of Bath. More birthdays ago than I would care to admit. From there, I went on to work in community pharmacies across the region, from Bideford in North Devon to the heart of Bristol, and indeed even in Clevedon, a town I'm honoured to represent as the Member of Parliament. During my time working in village, town, city and even online pharmacies, I was witness to the irreplaceable value pharmacies and their teams provide to some of the most vulnerable in our society. But I'm sad to say that I also experienced many of the challenges the sector now faces, and indeed it was living with those challenges and seeing the unnecessary suffering that resulted from due to the decline of community pharmacy that prompted me to run for Parliament earlier this year. Over the past 2 decades working in community pharmacies across the South West, I have seen firsthand the consequences of pharmacy being neglected by the previous government for 14 years. Not least their bad Brexit deal, weakening our cooperation with our nearest neighbours. We have cut off the supply of pharmacists coming from Europe. We have greatly exacerbated our supply chain issues, resulting in medicine shortages, and we have contorted the MHRA into a role it was never designed for and has since failed to live up to. But undoubtedly, the worst thing the previous government did for our industry was freeze the funding settlement for 10 years, resulting in a 40% reduction in real terms. This, despite ever-growing demands on prescribing and the introduction of the new role for pharmacists with Pharmacy First, the Conservatives prescribe pharmacy a tough pill to swallow, and it's going to take years to undo the side effects. And that is why we must not waste any more time. We must stabilise the sector today with a fair funding settlement while we begin the arduous task of reforming the role of pharmacy and the role it plays in our healthcare system. Pharmacy First was a good step, but with only 7 conditions eligible, it falls far short of Wales's 27 and Scotland's 30, with the scheme in England fraught with issues, not least in payment. While the obvious priority to expand pharmacy first, and thus relieve pressure on GPs, we must first expand pharmacies' capacity, and that can only be done by finally implementing the hub and spoke legislation, which was inexplicably shelved in September without warning or explanation. Hub and spoke Model 1 would allow smaller independent community pharmacies to finally take advantage of the technologies larger chains have been utilising for decades, greatly increasing their efficiency and freeing up time previously spent on dispensing towards delivering clinical services to patients under an expanded Pharmacy First scheme. I'm eager to see this government avoid the mistakes made during the past 14 years that have brought our sector to a crisis point, and I thank the member for raising this debate and the Minister for his time listening to our concerns. We have a once-in-a-generation opportunity to rewrite the story of pharmacy, which is a long and rich history of healthcare provision in this country, but which now faces an uncertain future, with some in the sector concerned we may not survive past 2039. The prescription for pharmacy is an immediate funding settlement for this year that would stabilise the sector with a sticking plaster, while we look at the longer-term changes the industry needs. Having been on the ground for the past 20 years, I'm here to tell you that pharmacy has cut every ounce of fat that can be cut. All that is left is bone. Without advancing the modernisation agenda, this is a sector that has no more efficiencies to make, and for that to happen, we need the government to commit to implementing the hub and spoke model to increase capacity and expanding Pharmacy First to utilise that capacity. Pharmacy has an important future role to play in relieving pressure of other parts of our healthcare system, but it can only play that role if we proactively engage with the sector rather than leaving it out in the cold for another 14 years.
Steve Darling.
Thank you, Mr. Chairman. It is to serve under your chairmanship, and I'd like to congratulate the member for Tiverton and Minehead for securing this really important debate. My personal reflection initially is that a number of primary care providers came up and spoke to a number of Devon MPs only a few weeks ago. Clearly it included GPs, dentists, opticians, and for this debate's purposes, pharmacists. And they shared with us the crisis that this front line of our NHS is currently facing. They also shared with us another challenge that I will ask the Minister towards the end to particularly reflect on, how the National Operation Framework 4 is putting additional pressures on our services in Torbay, and how the Integrated Care Board, not Torbay, in Devon, and also how the Integrated Care Board is also challenging as well by some of their decisions as to where perhaps less prevention opportunities are being taken, hence the pressures on the primary care world, and more money being spent on the acute. And just as this government is quite rightly highlighting the need for children's services and adult social care, that prevention is better than cure, this is exactly the same for this area of our NHS. I'd like to turn to my constituency, which is Torbay, and we now have 22 pharmacists serving our communities across Torbay. Sadly, we have lost 7 pharmacists in recent years, which has a significant growing of pressure on those pharmacists who still trade in Torbay, and that is of grave concern. We have an older population in Torbay, which clearly means there is greater footfall for the help of our very helpful pharmacists in Torbay that we require. But also, I would like to reflect that over the last 10 years, the support from the NHS, the spend on pharmacists, 10 years ago it was 2.4%, it is now 1.6%, and if our world, Mr. Minister, is around prevention, that is going in the wrong direction. Again, colleagues have rightly raised the Pharmacy First approach and how that has almost saved in the Torbay constituency a little under 500 GP appointments. we need to push harder on that agenda. So, so I'd like to put to the Minister, and I'd like to curry a little favour with the Minister by sharing with him that the first manifesto I bought had his father on the front of it, and I still have, and I still have it up on my shelf, despite my wife wanting me to clear out my office on a very regular basis. But I would like you to severely reflect on not for and whether it is part of the problem rather than the solution for our NHS services, and also ensuring that we get, as colleagues have already alluded to, making sure that we actually get that long-term funding for pharmacists, that is that strength that they can then build on. Thank you, Mr. Chairman.
Right, and I'm going to have to squeeze people down to no more than 4 minutes, please. Absolutely. Anna Gelder.
To serve under your chairmanship, Mr Betts, and thank the Honourable Member for Tiverton and Minehead for securing this debate. After decades of Conservative government, our NHS is on its knees, and we see this in our long waiting times, overcapacity within GP services and hospitals struggling to meet demand. In the middle of this, community pharmacies have been quietly stepping up, taking on more responsibilities to help NHS colleagues and to ensure that our communities aren't disadvantaged further. However, underfunding, medication shortage issues and a reduction in the skilled workforce have left many pharmacies in crisis. According to the Company Chemists Association, across the South West, we've lost over 300,000 hours of pharmacy care per year, 40% of those hours due to reduced opening times and 60% a result of permanent closures. Behind these statistics are real people in our constituencies who are now struggling to access the care that they need. And community pharmacies are trusted pillars of our communities and a key part of the wider healthcare system. For areas like my constituency of South East Cornwall, where we have a large elderly population and residents that often have to travel very large distances to access healthcare services, our pharmacies are vital lifelines. I know that this government has a plan to rebuild our NHS, but this will take time, and in the interim, we need to do more to support our pharmacies so they can continue to support our communities. Great initiatives like Pharmacy First have demonstrated that pharmacies can support our NHS and deliver for residents when they are empowered to do so. These schemes can help free up GP capacity and improve patient access to treatment for common conditions. However, there is more that could be achieved, and so I ask if the Minister could outline what support will be made available for our community pharmacies in my area of South East Cornwall and across the South West. Thank you.
Vicky Slade.
Thank you, Mr Betts. It's a pleasure to serve under your chairmanship, and particularly to follow the member for North Somerset, who I think indicated it may be his birthday, which means that not only he but I share our birthday with the Pope. So, of course.
I would like to congratulate the Right Honourable Member on having the best birthday. And I hope you can pass that on.
Okay. Vicky Slade.
Thank you for that intervention. Like my colleagues, I've had a lot of correspondence about community pharmacies in Mid-Dorset, North Poole, from residents and also from pharmacists themselves. One of my residents, Ruth, in Wimborne, visited Quarterjack Pharmacy for me at the weekend to get some data. I asked her to get some specific examples of drugs where the price differential between what was being paid and what was being reimbursed was particularly high. He gave her a whole list of drugs where the money received was substantially less than what he got, and said that the precise amount varied from week to week, including one drug called apixaban, which is prescribed to prevent strokes, presumably, potentially saving the NHS a lot of money. So I wonder whether the Minister agrees that this is unacceptable and what commitment he will give to updating the contract urgently. Next, turning to the issue of medicine shortfall, I can't tell you how many people have told me about having to go around the county trying to find the medication that they need. Patients with epilepsy, ADHD, Parkinson's, sight loss have all contacted me worried about their health. And David was explaining about his issue with epilepsy and that stress can increase the chance of seizures. I can give you a personal example. My husband Paul also has epilepsy, which is controlled by drugs, and if he has one seizure, he will lose his driving licence again. He's just got it back after 2 years, and I really do not want to be driving him round. So the idea that we lose access for people to be able to work and drive is mad. The list of medicines available under prescription do include epilepsy, but not Parkinson's. And I'm wondering whether the Minister would agree that it's high time this list was updated, given that it was last changed in 1968. Yes, indeed. There's also been a consultation recently about allowing non-pharmacists to give out a bagged medication and for pharmacists to give approved persons the right to be able to issue medication. And I did write to the Minister to ask when we were going to get a result on this, and I was told that it was still being considered. So I really hope that today he might give us a timeline on when we can expect that for our pharmacists. Finally, an issue about dispensing GPs. In one of my villages, the GP dispenses out of a side window of the surgery, with patients expected to wait in the cold. When I asked why they couldn't reduce this inconvenience for patients, who are often out there for 45 minutes, I was told it was because they can't make up prescriptions for 3 months instead of 1, because they get paid per prescription and not by the drugs. And so the GP would be out of pocket if they made a prescription up for 3 months. That seems outrageous, and if it's true, I would like to ask the Minister to urgently review how this works, so dispensing GPs and pharmacists are not out of pocket in providing better service to their patients. Thank you.
Morello.
Thank you, and it's a pleasure to serve under your chairmanship. And I'd like to thank my good friend, the Honourable Member for Tiverton and Minehead, for securing this important debate. Community pharmacies are indispensable to West Dorset, serving as an essential health hub for our communities. However, they face mounting challenges, including escalating financial pressures, critical workforce shortages, which threaten their ability to continue to provide these vital services. West Dorset, amazingly, is served by only 18 active pharmacies for a population of over 100,000. Data from NHS Business Services Authority shows that the number of community pharmacies in England has declined by 6.7% since 2001. In the past year alone, there's been a further 217 pharmacies lost, and startlingly, it is those not offering in-person services, often called distance-selling pharmacies, that are the least likely to fail. This demonstrates that the new role pharmacies are having to play in our healthcare system is actually hurting their viability due to the broken funding model. Workforce shortages exacerbate the strain. In NHS Dorset, the integrated care system that covers West Dorset, there are 47 vacancies, equating to a vacancy rate above the national average of 19%. The impact of these staffing challenges is clear. A 2024 survey by Community Pharmacy England found that 3/4 of pharmacy team members reported staff shortages. Approximately 10% of pharmacy owners had no choice but to temporarily close their doors as a result of these shortages. For patients, this means longer waiting times, reduced services, less access to advice for urgent healthcare concerns. For staff, it translates to unsustainable workloads, difficulties in sourcing medicines, and most alarmingly, increases in patient abuse. Nearly all respondents, 92%, reported struggling to cope with the pressure, highlighting the human toll of the pharmacy crisis. The recent rise in national insurance contribution places an additional burden on pharmacies as an employer, particularly in rural areas where revenue streams are less predictable. I have one pharmacy in my constituency that made a 6-figure loss last year before the increase in national insurance contributions came in.
Will you give way?
Of course I will.
I thank my honourable friend for giving way. As he's rightly pointing out, the employer national insurance contributions alongside the national living wage are increasing the pressure on our really important community pharmacies. So does my honourable friend agree with me that the government must urgently exempt pharmacies, GPs and dentists from the tax hikes to avoid considerable damage to the sector?
I thank my honourable friend for the intervention, and she will be pleased to know that there is in fact a Liberal Democrat amendment right now to do exactly that, which I'm sure we will all be voting for and would ask the government to take the opportunity to support. Community pharmacies already face slim margins under the current community pharmacy contractual framework funding model, and while initiatives like Pharmacy First have brought new funding streams into the sector, they're not sufficient to offset the rising cost of operation, including wages, rents and utility bills. Community pharmacies are lifelines for rural constituencies like West Dorset. They provide crucial access to healthcare services, especially for those who struggle to reach GPs or hospitals. But they are also uniquely vulnerable due to small patient bases and higher operational costs, and the government should recognise these disparities. This means revisiting the funding framework, addressing workforce shortages, offering targeted financial relief to offset rising costs, including the impact of national insurance contributions. And, Mr Chairman, community pharmacies are not just businesses. They help support our strained healthcare systems and are a part of our community. For the people of West Dorset and for millions across the country, we cannot afford to let them falter. I urge the government to prioritise this issue, undertake a comprehensive review of the funding model, work closely with Community Pharmacy England and provide the support necessary to secure the future of our pharmacies and the vital service that they deliver in rural communities.
Richard Ford.
To serve under your chairship. Growing up, people used to talk about going to the chemist. And at the time, I sort of saw this alongside going to the butcher or going to the shoe shop. It was just where you went to buy stuff. But what I didn't realise is how crucial pharmacies are to prescriptions and thus to people's health and well-being. I'm ever so aware of that now that I represent a constituency in Devon. Under the last government, in the last 2 years alone, Devon has seen the closure of 9 pharmacies, leaving the county with just 133. And that translates for the people I represent in Honiton and Sidmouth to just 16 pharmacies per 100,000 people, even fewer in West Dorset. And that's partly because income for pharmacies has stagnated, particularly with regard to what it receives from the NHS. This is combined with rising costs, including energy bills, wages, but also the cost of medication. And altogether, it makes for an unsustainable financial model. And yet, pharmacies provide over 1.3 million consultations each week for people's health concerns and is keeping people out of the NHS. It's saving 38 million GP appointments every year. Just last month, a pharmacist in Devon noted that his team spends over 2 hours per day providing free, unfunded clinical consultations. And these prevent health conditions deteriorating, they prevent hospital visits, and they prevent additional strain on the NHS. Yes, I will.
I thank the honourable friend for giving way. He raises a very important point, which is that under the current funding model, pharmacists are only reimbursed if the consultation results in a prescription being issued. Now, this results in a medicalisation of the process. It means that pharmacists are less likely to provide other sorts of solutions, such as community care and so forth. Does he agree with me that actually that model is fundamentally flawed and creates a medicalisation issue?
Well, it is flawed, and particularly for those parts of the country that are rural and coastal, like the constituency he represents and that which I represent. In Honiton and Sidmouth, the average age of the people I represent is 56. And I went to a meeting of the all-party parliamentary group last week on ageing, and we hosted Sir Chris Whitty, the Chief Medical Officer for England, and he was describing how, whereas in some societies people move away from the coast, away from rural areas to seek comfort and care in towns and cities, in England we do quite the reverse. And so this makes it even more crucial that we maintain our pharmacies in these rural and coastal communities. So, in short, we're calling for the government to provide funding to halt the closures and stabilise the sector, ensuring that rural communities like those in Devon are not left behind. We want to see the expanded role of pharmacists to enable them to offer greater prescribing rights and bigger public health responsibilities. Very briefly.
Thank the honourable member for giving way. Just on that point, I think it's really important that we widen the discussion to talk not just about stemming the loss of pharmacies, but also about how we can put pharmacies back. I know that in the South West, community hospitals would act as an excellent venue for these. So does the honourable member agree that actually we should be looking at community hospitals as a potential venue for new pharmacies? So it's a bit of a one-stop shop where people can access healthcare and advice.
I think the honourable member for South Dorset has come up with an absolutely brilliant idea, and I think community hospitals are potentially the hubs where we might see pharmacies sitting in the future. Very last point, Mr Chair, I'd like to pay tribute to the honourable member for Tiverton and Minehead for securing the debate. She's done a great thing by doing so. Thank you.
And move on to the front benches. No more than 5 minutes for the two opposition, and the Minister, probably about 10 minutes left, thereabouts. First of all, then, Dr Danny Chambers for the Lib Dems.
Thank you, Chair, for calling me to speak, and I pay tribute to my colleague for securing this debate, and it's a very timely debate because Winchester Hospital has just yesterday declared a critical incident, as they've had so many infectious patients come in with various flus and norovirus and other infectious diseases, and they're short on beds, and they have specifically asked people to seek other health care arrangements, specifically mentioning pharmacies as one place to go to for this advice. And we know that, along with more social care packages to free up beds, one part of the solution to preventing the yearly NHS winter crisis is increasing the delivery of flu and COVID vaccinations well before winter. And we know it's seen that with the right government support, our community pharmacies are very well placed to deliver that. Because it's not just about accessibility, but it's also about convenience as well, and it's delivering care often right in the heart of a community. So I've been to many pharmacies in and around Winchester. There's Springvale Pharmacy in Kingsworthy, there's the Wellbeing Pharmacy in Winchester High Street, the Colden Chemist in Colden Common. And I've spoken to all the staff that work there, and I've heard firsthand how the NHS funding model is really not working for them at all. And I was really saddened to hear that many of these pharmacists, although they're completely passionate about their work, they're really struggling to see how they'll better remain open for the next 12 to 24 months.
On that point, would you give way?
Yes, I will give way.
Thank my honourable friend for giving way. Pharmacies in two of the major GP surgeries in my constituency, Leadside in Totnes and Compass House in Brixham, have closed in the past year because the private operators couldn't make a profit. So would my honourable friend agree that it's urgently time that we revise the funding model for prescriptions so that pharmacies, particularly in GP surgeries, can survive?
Yes, I completely agree. It's been brought up by other members here today as well, that it's actually in some cases costing pharmacies money to dispense NHS prescriptions, and that's clearly not viable, especially when, since 2015, the core NHS funding for pharmacies has been reduced by around 30%. Now, we know that there are some healthcare providers that are really struggling on the brink of financial viability. We've got, include pharmacists, hospices, some social care providers. And we know that the increase in national insurance contributions is going to cost the pharmacy industry approximately £50 million extra this year. And so once again, we'd urge the government to exempt some of these healthcare providers from the increase in national insurance, or potentially repay that money in another mechanism, because when you're operating on the brink of financial viability, this could be a death blow to some of these social care providers, pharmacies and hospices as well. I just want to thank as well all the hard-working pharmacists, like our colleague who spoke earlier today. They really are part of the community. People come in, they trust them, they have a really good personal relationship, and the work they do, the hours they work, pharmacies are a lifeline for millions. They provide nearly a third of consultations outside normal working hours. They're often the only point of care for people who live in rural areas. And as our population grows older, faces increasingly complex health challenges, pharmacies must be empowered to step up and deliver the reliable and flexible care solutions that our communities desperately need. And just a final point is that as we talk about the strain on the public finances and the NHS budgets, we cannot be tempted to see primary care, whether that's GPs, whether it's mental health provision, whether it's pharmacies, or dentists, to see them as a cost to be cut. We must be investing in them and making sure we keep them viable, because it is always more cost effective to treat people in their communities and prevent them from getting ill than treating them when they end up in hospital. Thank you.
Dr. Luke Evans for the opposition.
Thank you, Mr Betson. It's a pleasure to serve under your chairmanship and be across against the Minister for the first time. And as a GP myself, knowing that 38 million GP appointments are saved each year, I'm very grateful for. And the temptation is to try and thank everyone. It feels like doing a set of prescriptions again, but I will pay tribute to the pharmacists, because whenever I used to get a call from a pharmacist, I always knew they were right and I should listen very carefully to what they say. As of January 2024, there are over 10,000 pharmacies providing NHS services, and 80% of those are within 20 minutes of walking distance. So we know that the number of registered pharmacists also grew consistently under the last government, up 61% in 2024 compared to 2010. And I'm pleased to hear that the government is still committing to the NHS workforce plan to ensure that there are still difficulties, as we've heard today, in making sure recruitment is met. However, as has been rightly pointed out by the member for Tiverton and Minehead, and I congratulate her on securing her first debate, there are many difficulties here in the sector, and I'd like to take a quick canter through them, and with 5 minutes I have 5 questions to the Minister as well. The first and most obvious one is the community pharmacy contractual framework, which is so important to the financial agreement for 24-25. Now, this was a deal struck back in July 2019 to provide 2.59 billion annual funding to NHS pharmacy services. Now, the last government, the NHS, published a delivery plan in 2023 for improving access to primary care, which included 645 million investment over 2 years to expand community pharmacies. But the delays in the negotiations are having a real impact on pharmacies across the country. In a recent letter, Community Pharmacies England wrote, there will be no community pharmacy sector left to deliver the contractual framework, let alone the future ambitions of the government and the NHS. So question number 1, can the Minister provide an update on the negotiations, when this will start, and will there be published terms of reference? The next has been rightly highlighted is the impact of the national insurance contributions and national living wage, a government's choice to burden the sector, and we've heard it set out about £50 million. Now, the government has exempt the secondary care particularly, but no such commitment made to community pharmacies. So, question number 2 is, was the Health Department aware of the Treasury's decision, and did they raise concerns about pharmacies and the impact this would have? After all, this has led the National Pharmacies Association voting in favour for collective action for the first time in history, saying, and I quote, the sense of anger among pharmacy owners has been intensified exponentially by the budget, with its hikes in NI contributions and unfunded national living wage increases, which has tipped even more pharmacies to the brink. So question 3, what mitigations are planned and when? As we've heard from the Prime Minister, Chancellor and Health Secretary, it will be done in the usual way. Could they set out, because decisions are being made now? Now, as has been rightly highlighted, turning to the evolving model of pharmacy first, the programme has shown just how capable pharmacies are, and it's been welcomed. There's great potential for this service to benefit patients. Yet actual recent data from the NHS England identifies that GP referrals to Pharmacy First in England can actually vary quite significantly across ICBs. For example, if we take Greater Manchester, there were 11,683 referrals, whereas NHS Cornwall and the Isles of Scilly, it was 612. Now, there could be obvious reasons like demographics or locations, but question number 4 would be, can the Minister clarify what the government is doing to promote Pharmacy First services and to share that data? And finally, I was really pleased to see the member for Mid Dorset and North Pool pick up the issue of dispensing GPs, because there are 948 dispensing GPs and they account for 7% of the prescriptions, covering almost 9 million people. And particularly when we're talking about rural areas. And not much is often mentioned of what they do. So I'd be keen to understand the government's position on dispensing GPs. So question 5, could the Minister set out how he perceives the landscape? Maybe he could write to me to give me, given the time constraints of this debate, of what it would look like. And finally, with our 30 seconds, The pharmacies stepped up during the pandemic. They were literally the lightning rod, not only for getting medications out, but providing the much-needed vaccinations that allowed us to relieve lockdown. Christmas is one of the busiest times for them. I've seen that firsthand. And I'd like to put on thanks, and on record, our thanks from across both sides of the House for a fantastic job that they do.
Minister to respond.
Thank you very much indeed, Mr Betts. It's a real pleasure to serve under your chairship, and I'd like to thank the Honourable Member for Tiverton Minehead for ensuring that this really important debate can take place today. I'll start by acknowledging and paying tribute to the outstanding work of community pharmacy teams in Devon, the South West and right across the country. I've heard so many examples of just how many patients and communities rely on pharmacy services and the length to which they go to deliver care. I thank them for their professionalism, their hard work and the dedication in providing excellent standards of patient care. It's a credit to them that surveys show that 9 in 10 people who visit pharmacies feel positive about that experience. Community pharmacies are often the most accessible part of our NHS, allowing people to access professional healthcare advice right there on the high street. They're also vital in supporting rural communities and people living in remote locations. Furthermore, as community pharmacies provide more clinical services, they help to relieve pressure in other areas of the NHS. This includes freeing up GP appointments, preventing hospital admissions, and reducing overall pressure on secondary care. However, for far too long, governments have failed to recognise community pharmacies' essential role in safeguarding the nation's health. On the 4th of July, we inherited a system that has been starved of funding, with a 28% cut in funding in real terms, and in many ways is on its knees, with far too many closures happening across the country. Lord Darcy's report laid bare the true extent of the challenges facing our health service, and even he, with all his years of experience, was truly shocked by what he discovered. But his report was vital because it gives us that frank assessment, that diagnosis, if you like, so that we can face the problems honestly and properly. It will take a decade of national renewal, lasting reform, and a long-term plan to save our NHS. We've committed to 3 key shifts: from hospital to community, from analogue to digital, and from sickness to prevention. Now, our 10-year plan will set out how we will deliver these shifts to ensure that the NHS is fit for the future. To develop the plan, we must have a meaningful conversation with the country and those who work in the system. So we're therefore conducting a comprehensive range of engagement activities, bringing in views from the public, the health and care workforce, national and local stakeholders, system leaders and parliamentarians. So I urge members, their constituents and staff across health and social care to tell us what's working, what needs to change. Please do visit change.nhs.uk and make your voice heard. This government is committed to restoring the NHS to its founding promise that it will be there for all of us and all of our constituents when they need it. But as identified by Lord Darcy's review, primary care is under massive pressure and in crisis. I recognise that it's a really challenging environment for colleagues in all parts of the NHS, including in community pharmacy. But we remain resolute and determined to fix this situation. Pharmacies are based in and are a key part of the communities that they serve. They are ideally placed to help tackle inequalities and to increase the reach and access to NHS services. This includes delivering a range of health advice and support services, helping to relieve pressure on and improve access to the wider NHS. Community pharmacies are a vital part of our NHS, and that has to be recognised in the development of this government's 10-year plan. They're central to the 3 big shifts in healthcare that I outlined earlier. I know that pharmacies can and should play an even greater role in providing healthcare on the high street. This will be imperative if we are to deliver across the government's mission, not just on the health mission, but also growth and opportunity. A healthy society and workforce are preconditions for prosperity and growth. We have a staggering 2.9 million people who want to work but who are unable to do so because they've been failed by our health and care system for the last 14 years. Community pharmacy has a pivotal role to play in getting our economy back on its feet and fit for the future, whether that be by identifying those with risk factors for disease, such as high blood pressure, or ensuring that people can access and use their medicines to best effect. So we, as a government, are fully committed to working with the sector to achieve what we all want, a community pharmacy service that is fit for the future. I'm keen to unlock the potential of the whole pharmacy team. We want pharmacists to be providing new and impactful clinical services, including our future pharmacist prescribing service. We want pharmacy technicians to have more responsibility in supporting the pharmacist to help people to deliver the best possible health outcomes. Every day, pharmacy teams facilitate the safe supply of medicines to patients, enabling them to manage health conditions as part of their daily lives in Devon, the South West, and right across the country. They also provide vital advice on prescriptions, over-the-counter medicines, and minor ailments. But pharmacies don't just dispense medicines and offer advice, they do much more than that. Pharmacies positively impact patients' health and support the wider NHS through providing a wide range of clinical services. Many offer blood pressure checks, flu or COVID-19 vaccinations, contraception consultations, and many more locally commissioned services. I will go.
I'm very grateful. He's espousing brilliantly what community pharmacies do. This all comes under a contractual framework, and one of the key things the pharmacies are asking for is when those negotiations will start and what the terms of reference are. I wonder if you'd address that point, given time to tie it.
I thank the Shadow Minister for that intervention. I am as frustrated as everybody is about how we are delayed. The reason for the delay is because the negotiations didn't get over the line before the general election. The general election came, and we spent a lot of time now clearing up the disastrous mess that the previous government made of the system. I can say that we are now very focused on getting these negotiations started early in the new year. And of course, I know that honourable members across all sides of the House are going to be very interested in that, both in terms of the contractual framework, medicines margin, all of the funding. All of that has to, because we have a statutory duty to consult with the sector before we can make any announcement. But I can say that we're confident that we will start the negotiations early in the new year. On Pharmacy First, it's something we supported from opposition, and we will build on the programme in the future. We look to create an independent prescribing service where prescribing is an integral part of the services delivered by community pharmacies. We're also doing a lot of work on the IT infrastructure, and we're looking to make sure that the sector is able to more easily prescribe and refer through better IT, and that is an important part of our shift from analogue to digital. We need pharmacies delivering services that help patients access advice, prevention and treatment more easily. Services that help people make best use of the medicines they are prescribed and ease some of the pressures in general practice and across parts of the NHS. There are over 10,000 pharmacies in England. They're busy dispensing medicines, offering advice and providing these services. Patients across the country can also choose to access around 400 distance-selling pharmacies that deliver medicines to patients' homes free of charge. They play a vital role in reaching the most isolated members of our society. I'm very keen to ensure that the Honourable Lady has a minute at the end to close. So in the short time that I have available, I wanted to perhaps just say a couple of words about her constituency, where there are 15 pharmacies. We're aware of the closure of one pharmacy in her constituency since 2017, and that the local population instead get their medicines from the neighbouring dispensing GP. I also note that according to the latest data in Devon, there are 203 pharmacies, and across the South West, 916. Where closures have occurred across the South West, the ICBs are working through the process of approving applications from new contractors. Some applications have already been granted. Following approval, the new pharmacy contractor has 12 to 15 months in which to open a pharmacy. So the ICBs are also working with GP practices and other contractors to minimise any temporary disruption for patients. In conclusion, community pharmacies are a vital part of the NHS and communities across our country. The government's committed to supporting them now into the future. I look forward to working with pharmacists across the country and to honourable members across this House as we progress our plans to embrace the skills, knowledge and expertise in pharmacy teams.
Rachel Gilmore to wind up.
Thank you. The Health and Social Care Committee reported in May said this: the undoubted potential for pharmacies to improve access to healthcare, crucially including immunisations and reduce pressure on general practice and other areas of the health system, can only be realised with the right support and the right investment of public funding. Why then are we not hearing anything from government on the support for pharmacies? In under a decade, the proportion of NHS funding on pharmacies has fallen from 2.4% to 1.6%. An average pharmacy relies on NHS funding for 90% of its income. It doesn't have to be like this. The sector is ready. It just needs the backing. We know that pharmacies across the country and the region, and if I may say so, especially in Tiverton and Honiton, Minehead, are willing to provide these services. Pharmacy first.
Order, order. Sitting stands adjourned.